All right, so we're here today to discuss a case with Dr. Frank Mirabelli, and I'm going to turn it over to him very shortly. We've been working together doing the 10 Past Ma series, and then I have put in specific remedies from Germany, from Heal, for his case. And I'm going to let him describe his background, medical background, and what his current issue is and was, and how the progression of ozone therapy has helped him.
Well, let's see. I guess for my profession, I am a medical speech pathologist. I have been in that profession for about 40 years. And essentially I work with a lot of patients who have significant difficulties. And I myself had significant difficulties because I was diagnosed with cancer in 1998 and had numerous radiation treatments, 66 fractions, as well as chemotherapy and Sloan Kettering, which was very effective considering that the majority of the physicians thought I was terminal. So I'm very happy to be here, and that's wonderful. And then reoccurrence occurred for cancer for me 4 times. And then I started to investigate a lot of different alternative approaches. And in, I guess you could say, August of this year, I started to take a really, I guess you could say, a really research point of view of how ozone therapy is utilized, because when you read about ozone therapy on the internet, you read a lot about insufflation, either rectal or otic, and you don't really read too much about using ozone infusion. And I read more and more from different places in Europe, primarily Germany, where there were numerous clinical studies utilizing ozone treatment that seemed to be miraculous for the people who were taking the therapy. And a lot of the clinical studies were very pointed, and the individual would present with numerous types of disorders, from immune system to cancer to arthritis to Lyme disease, and this approach seemed to be very effective. So I had called Dr. Isadora Guggenheim in, I believe it was August, September.
Yes.
And I was having difficulty with my left eye. I was diagnosed with herpes simplex 1, which is very common, but it ended up on my left corneal tissue, which essentially I was losing vision in my left eye because of all the clouding and scarring. I had consulted numerous ophthalmologists and went through a regular regimen of treatment, but nothing was effective. So I spoke to Dr. Guggenheim. I was very lucky to find her, by the way, because you can't find ozone treatment really in too many places in the United States. So I was very overjoyed when I found out that she and Janet practiced in New York, and made the appointment and came to see her. And my first treatment, I must say, was outstanding for me, because the residual that was left from my blood following a 10-pass system approach, which is an infusion using oxygen and ozone, really was, for me, outstanding, because it removed cancer cells from my body. I felt absolutely wonderful. I was experiencing lots of fatigue. I was experiencing difficulty with maintaining my schedule during the day, seeing numerous patients, and after the treatment I really felt wonderful. I felt as though a lot of my abilities were restored. And Dr. Guggenheim and I spoke about what were we going to do with my left eye.
With the infection.
With the infection, because
Even the pharmaceutical treatment for it, unfortunately, it may work, but it can also lead to blindness.
Yes, as a matter of fact, my ophthalmologist had said to me that the treatment protocol for my herpes simplex was in fact causing toxicity in the left eye because of the number of times I had to use it daily. And he was very reluctant to continue. So we decided that we were going to try to use ozone directly on the corneal surface. First using a cup, and then using direct ozone contact. And when I went to see my ophthalmologist, he was astonished in all candor. The virus was dead in the left cornea. The vascularization was disappeared. There wasn't anything left on the cornea to indicate any infection was present. The cloudiness was improving every day in terms of my clarity of the left eye, and presently now I have some residual cloudiness of the cornea simply because of the scarring from the infection, and that too is improving simply because over time the cornea tends to smooth itself out. So I'm no longer on any medications for my eye, and I'm here today. I believe this is my fourth time.
I think it is your fourth time.
Yes, my fourth time for a 10 pass of infusion, and I believe not only from a personal point of view but from a professional point of view that this approach would be very, very effective for numerous individuals who present with a variety of difficulties, whether they be neurological or immune-based or arthritis-based or infection-based. I truly believe this therapy is extremely effective, and I would encourage people to read information as much as you can, and please take the time to speak with Dr. Guggenheim and find out that this approach really is very, very effective. And just as an aside, I want to add something. My wife, Jeanette, was diagnosed with breast cancer a little bit more than a year ago, and she had surgery and radiation, and I brought my wife here to have a 10 pass. And Dr. Guggenheim formulated an approach for her to remove any remnants of the breast cancer, and my wife feels wonderful. All of the joint pain from the medication she was taking have dissipated. Her ability to go through the day is pretty normal now, and she's thrilled. As a matter of fact, she's waiting to come back for her next session, which she believes she wants to know when and how come it's not today. And I also brought my daughter here. My daughter Natalie has autism, and I brought Natalie primarily because I wanted to see how effective this treatment protocol will be, because Natalie presents with anxiety, OCD, and really all of the behaviors that normally occur in a young woman with autism. And we found that Natalie's behavior changed significantly. A lot of the anxiety dissipated over the next day or two after the treatment. And Natalie, too, has expressed numerous times, when am I going back to see Dr. Guggenheim? Because she feels much better. Now, when I ask what much better means, Natalie defines it as, my mind is clear, I can think, I can focus, and I don't have anxiety. So, and her OCD, which really causes her to lose control of her ability to make decisions, or she keeps focusing on the same types of activities, repetitive types of activities, they dissipate completely. So I believe also that this approach would be effective for individuals who have this type of disorder of autism. So in my mind as a professional, the more information that is passed on to the public to make them aware that this approach is effective, that it does work, I think would be really, that would be the beginning of how to bring about change really in everyone for this country.
And as a side note too, we did try to create eye drops out
Yes.
of your blood.
Yes.
We drew blood out, then we spun it down, and then we took the plasma and then ozonated that
Yes.
and made the eye drops. But that didn't really work.
It didn't.
As
What I found
as
is
well.
that when we did the plasma and ozonated,
Mhm.
it seemed to work initially for about a day, and then it seemed to stop working because I usually come to visit you on the weekend, and I see my ophthalmologist on Wednesday. So he looked and said, really, it didn't change too much. What really brought about the change was the direct contact with ozone, and you know more about that than
Well, yeah,
I
so
do.
direct contact is just putting ozone into a syringe without a needle, and then just having the patient keep their eye open or helping them to keep the eye open, and then directly injecting the ozone into the eye. And there's a slight burning sensation that you experienced right
Yes,
after that, but then did that dissipate?
It lasted for maybe about 2 minutes, and then I put some drops in my eyes, just typical OTC drops, just to lubricate the eye. And then we had the second treatment a few minutes after, and truly, in all honesty, within 1 day, I was much better, and the ophthalmologist confirmed on that Wednesday that there wasn't any virus any longer on the cornea.
And I believe we used 20 gamma of the
Yes, we
ozone, and then we may have gone up to 40
Yes, we
with
did.
that. So that's where we initially started, was at the 20 gamma.
Yes. Mhm.
And is there anything else that you'd like to add, or
I would like to add something that I think is very, very important, that when someone is looking for treatment, the more information they read, the more that they can actually see that this approach works. Many times people or families are very reluctant to try something that's an alternative approach, that's something outside the sphere of medical influence. And what happens is sometimes people are afraid to even consider an alternative treatment. My feeling is this. I guess you could say, from a point of view of a medical treatment, the first and the most important is to do no harm. And this treatment really does no harm. If anything, it causes the most improvement without medication, without any type of side effect that I have seen or read really anywhere. So I would encourage people to really consider this as an alternative treatment for a whole host of really severe problems.
and that being said, we can also individualize treatment. We can also make treatment accessible by working with somebody's budget, so that it doesn't seem like it's so out there or it's so expensive. And then there are medicines from Germany that can regionalize in any organ system, or we chose ones that would be specific for your eye. And so I researched and found those that for also macular degeneration and any damage to the retina or the cornea. Dr. Frank was also born with macular degeneration, so there may have been some genetic differences from the beginning that kind of also serve as the foundation for what took place in your case later
Yes,
on.
that's correct.
You know,
Yes.
and then cancer treatments, although they were successful, may have also changed that further. in some
Oh, I
way.
agree, yes. Considering when you're taking radiation or you're receiving chemotherapy, yes, you're trying your best to eradicate cancer, but at the same time, your immune system suffers and your ability to, I guess, improve after the cancer is treated is really significantly impaired. Just from a personal note, I found it took me years before I could even maintain a schedule of seeing patients on a regular basis after receiving radiation and chemotherapy. So I believe that this approach is individualized. It can be set for each person, no matter what difficulty they're having, to receive really such a wonderful treatment that is effective as an alternative approach. And I think every person should call, request information, come, talk to Dr. Guggenheim
And Dr. Eisenbacher,
yes, and ask as many questions as you like, because I certainly did when I arrived, and I feel very comfortable, and I think you will too.
Yeah, we had running phone calls for a while.
Yes, we did.
Which was good.
Yes.
And
yes,
I
we did.
appreciate that, because we want patients who are involved in their case, we want people to be empowered, and we want them to understand the choices that they're making and how we can best support them, and that we want them educated about the process. So any questions are always welcome. I think that